This is life management, and we're in chapter 2 that has to do with safety, and we'll be talking about first aid. What is first aid? Well, the definition here, first aid is the immediate care given to an injured or ill person until medical help arrives. It is given to counteract shock, to relieve pain, and in extreme cases to save a person's life, a victim's life. So one of the first things we have to be concerned with first aid is, of course, breathing. And we'll be talking here about rescue breathing. When you have to do rescue breathing first, breathing can stop for multiple reasons. It can result from a collapsed windpipe, from burns, from breathing toxic fumes, for choking, on small toys blocking the airway of kids, an injury to the chest, or poisoning by drugs such as codeine or morphine or alcohol. All of these can stop breathing. Getting electrocuted can stop breathing. So there's multiple things that can stop a person from breathing. And that's what we have to be concerned, how to do rescue breathing. So rescue breathing is also called artificial respiration and can save a life. First thing, when you find an unconscious victim, you're going to tap them on the shoulder and loudly ask if they're all right. If there's no response, and the person is not waking up, then you need to know that you need to call 911 or the EMS system right away. Get that going because can be there in 10 minutes, especially if you have to do CPR. So to tell whether an unconscious person has stopped breathing, you're going to kneel beside the victim and place your ear or next to his nose and mouth and watch his chest. We call this maneuver look, listening, and feeling. So you get down there, look, listen to feel, so see if they are breathing, see if you need to start artificial respiration, right? You're going to have to place the victim on the back. You're going to roll them over on their spine, keeping their spine straight. Don't bend their spine either way, and straighten their head. So depending on if you think they might have a neck injury, you have to be especially careful of moving them, right? So the airway, you're going to use this method, head tilt and chin lift, to basically, in doing that, you can see and look, opening the airway. You're going to lift very, small pressure here, tilting their head back, and then just 2 fingers there on their chin. So this is the head tilt, chin lift. Finger up right under that bony part of the chin there. And then you're going to look, listening, feel for signs of breathing. That's the picture we have there. And, for a child, you're going to give 2 breaths and start CPR right away. You're going to look at, unless you saw that the child collapsed, then you'd go straight to CPR. And with the adult, you're going to start CPR immediately. If they're in this situation, they're going to need to have CPR. So for choking, we're going to be doing abdominal thrust, and I'll show you that, some pictures here. So let's go into the next page here. Abdominal thrust for choking victim. So a choking victim with obstructed airway can die or have brain damage in just 6 minutes. So we have to begin right away to clear that airway. And so if a person is choking, here's the universal choking sign around their neck. You think, oh, if their face looks like that, you think, oh my goodness, what's wrong with them? And there's no air going in and they're not coughing or anything, then you know that you're going to have to do something. And you're going to have to do this abdominal thrust. So let's put the picture here so you can see it. So if they are coughing or they're talking, you're going to encourage them to keep coughing. Don't slap them on the back or anything. Just say, keep coughing, keep coughing. But if they start and they can't cough hardly at all, and they're trying extremely difficult at breathing, and you'll say, are you choking? And because some people that have a heart attack can't talk either. So are you choking? And they may nod, or the universal sign of choking there, you'll know that they're choking. So then you can give them black back blows and abdominal thrusts. And we call this the Heimlich maneuver right here, this picture of the Heimlich maneuver. Now, it's the Heimlich maneuver, the victim is conscious. This is the victim's conscious, is standing upright. And so you're going to stand to the side slightly like this guy is doing here. And you're going to reach across his chest to the opposite side and have the victim lean forward, the heel of his hand, and do 5 back bows, and then arms around the waist here, you see, and one fist, and the thumb side on the midsection, slightly above the navel. See how, okay? This is the hand position here. Let me put it up so you can see better. Here's the hand position. See how you put here, and you put the other hand over. And it's basically pushing up on the diaphragm, and that bringing air up so that that whatever's lodged in their airway will be thrown up, so, or upward, I should say. So you grab, and doing this, you'll alternate with back blows and abdominal thrust. Even a child can do this. They talked of a child that was 5 years old that was on a playground, and their friend basically had hard candy in his mouth and had choked, and this little 5-year-old actually did the Heimlich maneuver and saved the other little 5-year-old's life. This is easy, so kids can actually learn how to do the abdominal thrusts and the upward movement. And remember the back blows too. So, and that point to get their airway cleared. You know, I wanted to tell a little story is when your mom, when she was little and she was in a coma, and they said it was actually the worst day because they said, well, they didn't think she was going to wake up. She might be able to walk, talk, see or hear, and all these things. And we were pretty upset. We were down in the cafeteria and sitting clear back in the corner. And Papu and I, you know, we were just like in a daze. And the whole cafeteria was filled with doctors and nurses, and you know how a hospital is. And this lady came clear from the back, and she was knocking over chairs. Nobody knew what was wrong with her. She was kind of a heavy-set African-American lady, and she was looking, and everybody thought, this lady is crazy. And she looked wild, and she came right over to our table, and then she looked at me, and I knew she didn't have the sign, you know, but I knew she was choking. So I got up and I started doing the Heimlich maneuver, and then she fell on the ground, and I had to, you know, pump on her, you know, doing the chest thrust and everything. And I looked around and I said, you know, we're in the hospitals, get some help. And, you know, so she did, and she, you know, basically choked up something. And then I got into the elevator afterwards with Papu, and there were people in there, and I prayed, I said, Lord, this is like the worst day of my life, and what do you have me do but save somebody's life? And isn't the way that what God does? Basically, he was telling me, the Lord was telling me that he was going to heal Jessica, and he was going to heal your mom, and that even on the worst days of our life, sometimes God has us save people's lives. I had to tell that story because that's my Heimlich maneuver. I haven't given it very often, but that time was on the worst day of my life. And later on, I'll always remember that God was with me. He even had me save somebody's life on my worst day. So anyway, going on, if the victim is conscious, you know, we went over doing the Heimlich here. Let's see. Let's go on here. Kind of lost my place. Okay, if the victim is unconscious, that's what we're going to talk about. So the victim is unconscious. You lay the victim on, here's a picture, you lay the victim on their back, and you kneel to their side of their chest, and one hand is the center of the chest, and the other hand on top of the first hand, and then you give 30 chest compressions. Just remember, 30. So you're doing these chest compressions, and this will probably cause, you know, whatever, the diaphragm to be moved, but basically the air now being relaxed, probably that whatever's blocking the air will come out, you know. So then you open their mouth, you can turn them to the side a little bit, and you take your finger and sweep. See if they have a picture here, I guess. Well, here's a picture of the chest compressions and how, see how the arms are straight, And basically chest compression with one hand, heel of the hand here. And it's usually about two finger lengths above their sternum. And you can feel their sternum here, and you go 2 finger lengths above it and then start to get so you're not going to press on the end of their sternum and break their sternum bone, right? That's why I always kind of put 2 fingers. I can feel the sternum usually, and so you know where to put your hand. You put your one hand down and the other hand on top. And then keeping your arms straight, this is the position you would want to do. See how he is directly standing over the person, not from the side, so you're coming straight down. Okay, that's the positioning there. And so after you do this, you're going to basically finger sweep. If you see something coming in their mouth, turn them to the side. If they're going to vomit or there's obstruction a little bit, turn their head, their whole body to the side actually, if they don't have a neck injury. And then you're going to finger sweep and try to get it out of their mouth with just a finger sweep with your index finger, like that, sweeping their mouth, right? I don't think they show a picture of that there, okay? So the finger sweep is kind of important to get that and to get that out. So if it doesn't come out, then you're going to place the victim's head tilt chin lift, and you're going to put a shield over your mouth, because if they're still not breathing, and you're going to give 2 shallow breaths. And if the chest doesn't rise, you're going to retilt the head and you're going to try again. So here, after this, if this doesn't work and nothing works and nothing is coming up, then you're going to try to blow, in. And that position, basically, those 2 breaths, you'll know how to do, mouth to mouth, and covering this area and putting your cheek up against the nose side. So your whole mouth is covering, and it's covering the part of your cheeks, covering the nose. Breathe in. Breathe in. If it's still not going in, you reposition and you try to breathe in again, because you have to clear that. And then if that doesn't clear it, then you start doing chest 30 chest compressions again. So 30 to 2, right? You got to get it cleared out, because it only takes a few minutes and will not survive. So now, what if you're choking and nobody's around? It's just you choking, no one to help. What can you do? First, if you have a chair or some kind of edge like this, whether it's a chair or side of the table or something, you can do a self abdominal thrust, and do it on yourself, right where diaphragm is, and right in the same position. Push hard, lean over, try to get it cleared. A lot of people have been able to do this easily clearing their as for choking, especially if you're in a restaurant and they don't know. You just go over to a chair and do this, and people think, oh, they're choking, So, but use the universal sign if you're around. If you're alone, this is something you definitely could do. So, and as for an infant, what if an infant? Well, how do you do an infant? Let me see if they have a picture of it. Here we go. First aid for conscious choking infant. So the infant, so you don't administer CPR or anything if the infant is coughing. You're going to let them cough whatever's in their obstruction out, right? So if they're coughing, you're not gonna do this. So, but otherwise, if the infant is not coughing, the infant appears to be choking, you're going to place the infant face down. See how it is in this picture. Number 1, face down, and on your forearm. See how he's holding on the forearm right there. A lot of times it's good if you're sitting down too. If you sit down in a chair or something, so you don't drop that baby there. So face down, and then you're going to give 5 quick blows between the shoulders. 5 blows. And then you're going to turn the infant onto the infant's back and give 5 chest thrusts. So you're going to turn it. See how the baby's down here? 5 blows. Turn the baby the other way, and now you're going to give 5 chest thrusts. Right there towards the middle there, chest thrust. And you're going to keep doing that until the baby's airway is cleared. So, And make sure in the midst of that you call EMS too if there's going to be a problem. Get someone to come if you can't. If you're having a problem, they can get there sooner. But hopefully, after the baby's clear, the baby will start breathing again. So let's go on to cardiopulmonary resuscitation, CPR. Okay, here we go, CPR. CPR is when the heart stops. Usually more often with an adult, with CPR, although some children their heart do go into cardiac. When the heart stops, you call it cardiac arrest. And if you don't start their heart, brain damage can happen in 4 to 6 minutes. So it's so important that you resuscitate the heart. CPR gets the heart going, it's artificially going until someone arrives and they can actually try to start it. And of course, there's equipment you can use. They have to try to shock the heart to get it going again. So CPR causes of having to do CPR are, like a heart attack, electric shock, drug overdoses, hypothermia, very cold, water such that they've fallen in cold water, their heart can stop, excessive blood loss. All of these can stop the heart, and that's where you need to start it. So let's go down here, see if they have more pictures here, I guess on the next page. So the first thing you're going to do is you're going to call EMS, have somebody call, and then you're going to lay the victim on a hard surface. You have to be on a hard, flat surface on their back, and you're going to kneel at their side, and you're going to open their airway, just like we said before, with the head tilt, chin lift, and you're going to look, listen, and feel for signs of normal breathing. If they're not breathing, you're going to give 2 slow breaths to get them going, and then you're going to check their circulation. You can check their pulse in their neck, that's what basically, or check their circulation. If there's looking, you can always look. If there's severe bleeding, you have to stop the bleeding right away, because that's going to get them before the bleeding is going to cause major problems. So you have to look for that too if they're bleeding. But anyway, you're going to do chest compressions and 2 breaths. Let's see, I'm sure they have a picture here. So okay, let's go on to that. It says, check for normal breathing or coughing in response to slow breaths, any movement in response, or severe bleeding. So, you're going to look for circulation problems there first. And then you're going to go on to the chest compressions and 2 breaths. Okay, here we go. You're going to do 5 cycles of 30 compressions, and 2 breaths should be given in 2 minutes. So it used to be we would do more breaths, but now you're going to do 5 whole sections of 30, 1 and 2 and 3 and 4 and 5. That's how I count. 30 compressions. And then you're going to do 5 cycles of those, and then you're going to give 2 breaths. So here's the technique, the first part. Tilt, head, chin lift. There you go. Same as we did before. Pinch the nostrils shut and give 2 slow breaths. You see how the cheek is right against there, and you pinch them. You can pinch them with this hand as you hold the head back. This is the position of giving breaths. Pinch. I forgot to tell you to pinch the nostrils shut too, so that's important. So you can so the air will go in. So you're going to tilt the head, pinch the nostrils shut, give 2 slow breaths. Then you're going to give 30 chest compressions. See the technique here? You're going to do it right. You're going to measure right above the end of their sternum there, and put one hand on top of the other. You're going to lift the fingers off so the fingers are not pushing down and breaking ribs. And then you're going to go straight down, and repeat the cycles of 30 compressions and 2 breaths in 2 minutes. So basically, it's hard to find 2 minutes. You're going to do, how many cycles did they say? 5 cycles. 5 cycles of 30 compressions, and then 2 breaths given. So here's the picture. Give 30 chest compressions, repeat 30 more, and then after 5 cycles, when you think it's about 5, give them 2 more breaths. Okay? So that's basically CPR, and you're going to keep doing this. Once you start, you just keep doing it until someone comes and relieves you. or until you're so tired that you cannot do it anymore, so. Okay, if you have a conscious choking infant, how about the infant? Oh, we did the conscious choking infant, but an infant, you would do the same you would do before as we did the infant. You would do the chest compressions as we had before. So, okay, let's see. In case of drowning, CPR can be performed intermittently. That means, basically you can be submerged in the water for 10 to 40 minutes. So basically what they're saying is go as long. Here, where is it? In case of drowning, the above principles of resuscitation should be performed immediately. This technique has been successful in victims who have been submerged in very cold water to 10 to 40 minutes. Usually police or firefighters perform resuscitation on victims of drowning, but do not wait for them if they are not immediately available. Try CPR yourself until they come. Okay? So you can learn this technique from the American Red Cross. I used to teach it at the American Red Cross to the nurses. In fact, I was a nurse for the American Red Cross. And I also worked with the American Heart Association too, both of those organizations, not just teaching CPR, of course. I worked for the blood services there. And so I'm familiar, and we all had to learn CPR, and all the nurses and all, in fact, advanced, not only CPR, but advanced first aid, so in the midst. And so you can go and be trained in doing this, especially if it's for a job where you have to have no CPR. A lot of different jobs require that you know CPR, especially if you do with health professions or even in a teaching position. So, okay, let's see. Help for accident victims here it talks about. And we've come on accident victims before. Now, I've never had done CPR to accident victims, but I've had to deal with some first aid with accident victims. So, especially for people, getting so upset, almost going into shock, because shock is a big reason, people faint and, their blood pressure drops, and then plus they might have other problems, and they could actually die pretty quickly. So let's helping accident victims bleeding. Talks about the Good Samaritan in the Bible here, and coming and helping alongside of the road someone possibly injured and bleeding. And isn't it so important that we be good Samaritans in certain situations, and we know, especially in people that we know. So a person has 5 quarts of blood in their body, and if they lose more than 1 quart of blood, life can be threatening for them. So bleeding is important. You stop the bleeding. Use a clean cloth. Here's a picture here. Put direct pressure, elevate their arm, elevate, direct pressure, clean cloth to stop the bleeding. That pressure at the site is very important. And then don't remove it, the blood-soaked cloth, don't take it off. Just put another cloth on top. So if you start bleeding, it was bleeding through, get another one and put on top, and just keep pushing pressure, and don't ever take that, the blood-soaked off. Just keep them on. Always use latex gloves like that picture there, so they don't get contaminated, especially if you have a first aid kit. Sometimes you don't have latex gloves, but most first aid kits do. So apply the pressure, wrapping the gauze strips and clean cloths. You can wrap it over the dressing later on. This is called a dressing, and so you can wrap strips to hold it if it's stopping tightly, Tie or tape the pressured bandage on, and then always check for circulation of their fingers and toes that you didn't tie it. So make sure check their fingers and toes, make sure they're not turning bright blue. So check their fingers and toes and see if they're cold, and loosen the bandage if it seems that way. But make sure the bleeding doesn't start again, of course, if you loosen the bandage. So that's bleeding. Broken bones. Broken bones. What do? Well, you can know something's broken if it has immediate swelling. Now, it could be sprained, of course, but we always think most likely we need to treat for broken bones because, even if we don't have an x-ray, we can't tell if it's just sprained, but if there's swelling and maybe the arm or leg is bent in an unusual angle, it can be excruciating painful for them to move. There's two kinds of major fractures here. There's the closed fracture, where a bone is not penetrating through the skin, but a compound fracture is one that bone comes through the skin, and then we have to deal with bleeding and shock. This is way more serious, a compound. Just think of closed fracture and a open fracture or compound fracture. So to move them, if you have to move them anyway, you're going to apply splints because they're not going to be able to move around. You can't move that arm around. It needs to be held together in some way, right? So they apply splints. Splints keep the bones in place. You can use like broomstick handles, boards, rolled up newspapers, rolled up blankets, anything that's going to stabilize anything you have there. And so you're going to want to reach beyond the joint so that the joint doesn't move, so that it's very secure. And you're going to pad the splints so they don't rub against the skin. That's important. Maybe they have one here. Oh, here's the fractures here. You see, this is a closed fracture here, of course, and here's a compound where the fracture bone broken came through the skin. So those are fractures. Okay, here's the types of splints when we're talking about splints. You see, this is a rigid splint here, and you can see how basically you have to go wherever the break is, beyond the break. So you would go above and below, and then wrapping here, and also check for circulation there. You don't wrap it too tight there. So, and pads, see how they padded, a lot of times padding. This is very important, how they padded it, the splint here. This, they used newspaper such here to splint here. A rigid splint can be improvised from boards, straight sticks, magazines, and folded newspapers. So, okay. And to tie them up. Now, if they have signs of a broken neck or something like that, you're not gonna want to move them. And if they have the inability to move their toes or tingling in their legs or pain, you can always say, okay, maybe they might have a problem, so you don't want to move with a broken neck. Here's some more splints here, kind of important. Here's an anatomical splint that uses splinting it with a finger here. So they're splinting these together. This one might be broken. They're splinting these two together. Very easy to do, of course, just taping these together. Here's a soft splint. So soft splint here, and basically putting the soft splint can be made from a rolled up blanket, towel, or triangular bandage used as a sling here. So here we go here. And then this, of course, might have a broken collarbone or whatever, arm. However, to use a sling, how to put a sling on with a triangular bandage, and then wrapping around here so it makes it so that she will not move her arm, right? Those things are pretty important. So again, do not move a victim if they seem to have a broken back. Do not give anything for them to drink, because they might have to have surgery in lots of these situations. Like, I'll say, oh, I better get you something to drink. No, don't do that. Because, if they're going to have surgery, they don't want to have something in their mouth, You might want to cover them if they're cold or shivering with a blanket and reassure them. And make sure the ambulance is coming for them, right? And just don't have them be still. Don't move them unless you absolutely have to, So, shock. Let's talk about shock now. Shock could be very serious, even when they haven't hurt themselves that badly. But if they've lost, shock usually happens if they lost a lot of fluids or blood. That can happen, put them into shock right away. They have disturbances in their circulation system, and blood is not flowing in the usual way, and getting them nutrients and oxygen. So too long of shock can cause big problems, even death. Shock is life-threatening. And to treat shock immediately. Children, elderly, and people with chronic illnesses are more vulnerable to shock than any others. Shock can be most serious result of their injury, more than the injury, like I said before. So symptoms of shock, let's go over them really quick here. I'm getting kind of long, but I want to get through this quickly. Weak, rapid pulse. They have a very weak, rapid pulse. Shallow breathing, very irregular. Cold, clammy, moist skin. Paleness. Dull eyes or vacant expression. Confusion. Dilated pupils. Nauseated. Possible vomiting. Thirsty. Extreme weakness. These are all symptoms of shock. So, accident victim may have some signs of shock. Call EMS immediately. And while waiting, you're going to keep them warm. Lie them on their back if possible. And unless they've had a neck or head injury. And a lot of times raise their feet up. If you raise their feet up 8 to 10 inches, put something under their feet to raise it 8 to 10 inches, unless unless they have a head injury. Do not elevate their feet if they have chest bleeding or a head injury or back injury. You wouldn't want to raise their feet. But otherwise, just raise their feet up, and this will bring that circulation back to their brain, right? So never give fluids to an unconscious person, a person who needs surgery, or one who has a brain injury or a stomach wound or is vomiting. So never give fluids if they're going to think you might have surgery. I told you that. So that's important. So shock. Okay, the burn. It says an exception to the above is burn victims. Burn victims, you can give them something to drink. They may be given water if they are not vomiting and are able to swallow with no internal injuries. So now let's talk a little bit about burns. So there's first degree. It's kind of like a bad sunburn. The skin's red and feels warm to the touch. That's the first degree. The second degree, the skin is red and sometimes blisters. And sometimes the blisters are broken. So second degrees are red skin along with blistering of the skin. And the blisters may be broken or not. Third degree burns are the most severe. And this type of burn, the skin has been burned through, and the tissue, it's kind of a blackish color. The tissue has suffered much damage, and the skin may be black or grayish. It says there may be severe pain from a third degree, or sometimes the nerves have been damaged and they won't have much pain, so pain or not, but the third degrees are the worst, so. Never apply ointment, butter, or petroleum jelly to burns. That's an old wise thing, or old wise tale that we don't do anymore, because the doctor may have to have a hard time removing that ointment or butter or whatever you put on later on. First degree burns and second degree burns in which the blisters haven't been broken, you can cool it off. Like cool running water is the best thing for burns in that way. So cooling that, but if the blisters are broken, you're going to have a risk for infection. So for the first degree and second degree where blisters are not broken, you're going to run cool water or put cool cloths to cool them off. And this really, really helps, so for cooling off a burn. Now, if they have broken blisters or they're severe third degree burn, you're not going to do that. You're just going to put basically a dressing on the top of them, a dressing that is clean, and hopefully a sterile dressing if you have a first aid kit. So always after you cool it off, you're going to basically put dry sterile dressings on them. And for the severe second degree burn, you too will put dry, just no more cooling with the water, because you can't for the severe second degree open with blisters. And at the third degree, you're just going to put a dry sterile dressing to protect the wound from bacteria. A clean sheet can be used if bandages are not available. And immediate medical attention is so important for a burn, right? And so Remember, all victims of serious burns are at risk of shock and should be treated for shock too, right? How about when somebody swallows poisons? This is the last part. So when someone swallows poisons, we're going to call 911, or sometimes we have a poison control number to call. And we're going to tell them what they were poisoned with or what they swallowed. And then they'll give us direction, because sometimes they'll have us have someone induce vomiting by giving them the syrup of Ipecac right here, syrup of Ipecac, and that will make them throw up. But if they've swallowed things like gasoline or lighter fluid or alkaline solutions or some cleaning solutions, you would not want them to throw up, because once they throw up, it's going to hurt. It's going to come back and it's going to be worse. So they'll tell you if you need to give them the syrup of Ipecac, right? So that's important to know. But always just follow directions in a poison control. And so there's a lot of, even with bites and snake bites and stuff, they can tell you exactly what to do. So anyway, I like this, how it says, Jesus gave us an example of selfless first aid in the story of the Good Samaritan. He instructed us, go and do likewise. He says, I shall pass through this life but once. Any good, therefore, that I can do, or any kindness I can show to any fellow creature, let me do it now. Let me not defer or neglect it, for I shall not pass this way again. Antignac de Grelet. So here we want to be Jesus' example. So first aid is important, that we know first aid. Maybe a family member, or maybe a stranger, but God has us there for a purpose, and a lot of times because we know first aid. I knew CPR in the midst of the lady that saved her life at the cafeteria, and I knew the Heimlich mover. So we want to do what God would have us to do.